All right, so now we're going to talk about when things are messed up. So we're going to talk about hypertension. We're going to talk about how hypertension relates to disease, what are some treatments, preeclampsia, congestive heart failure, shock, and just some of the things that our body does to try to compensate for shock. So let's first define hypertension. Hypertension, as the name implies, hyper, we think high, tension, we think pressure. So hypertension specifically refers to high blood pressure. And this is a very, very common condition. A lot of people experience hypertension, especially, like we're looking at about half of all adults experience this. We see that this number increases as people get older. We see that people who have hypertension are at a higher risk of developing other conditions like cardiac diseases, kidney diseases. They're at a higher risk for developing a stroke. And we can classify hypertension based on like how bad it is, right? And how, what the cause is. So there's primary hypertension. This, we don't really fully understand why, but this is the most common. Or secondary hypertension is basically like the person has hypertension because they have some other condition. So the hypertension is not the exact problem. The hypertension is there because they have something else. They have a kidney disease, they have an endocrine disease, they have something, and hypertension is just like a result of that first condition. And if we manage the first condition, in a lot of those cases, we can manage the hypertension too. Whereas primary hypertension, we don't necessarily know why. There is no other condition the person necessarily has. They just have high blood pressure. If we look at what's considered normal and what's hypertensive, normal blood pressure is under 120 and under 80. So that's normal. Like 120 over 80 is considered like the normal blood pressure, although this can go down to like 100, 110 to 60 to 70. Right, there's a little bit of a range. And if someone has normal blood pressure, obviously we're not going to give any medication. Prehypertension means that the blood pressure is slightly elevated, so 120 to almost 140, and in the 80s for diastolic, so someone with a blood pressure of, let's say, 130 over 85 would be prehypertensive. Generally speaking, we don't give medications for this. Usually what we're referring that person to do is lifestyle change. So looking at exercise and diet primarily. Stage 1 hypertension is when we're in the 140s and 50s over 90s. We are still going to encourage lifestyle modification, meaning looking at diet and exercise, but we may also introduce medications. And then stage 2 hypertension, this is 160 over 100, same thing. We're still going to encourage lifestyle changes as well as medications. And then if we're like 180 over like 110 or 120, if I remember right, that's considered like a hypertensive crisis. That's like emergency room visit. Now, hypertension is known as the silent killer, and it has aptly earned that nickname because generally speaking, you don't know you have hypertension unless you've done one of two things. A, you've gone to a doctor and you've had your blood pressure checked. Or B, your hypertension has gone on for so long and so bad that you've actually experienced enough damage to notice. But by the time you notice the symptoms, it's already so far gone. So this is why it's a silent killer, because the only way you're going to know is either A, you went to a doctor and had it checked, or B, you are so far gone with it, right, that the damage is so severe that it can kill you, right? So we generally don't feel symptoms of hypertension. And this is one of the reasons why it is so important for this to be checked when we go to a doctor, right? When we go and get some sort of health check. And you'll notice like they check it often because one, it's not hard to check. It's relatively easy. It's not invasive at all. And knowing your status in terms of hypertension, knowing your blood pressure can literally prevent a world of hurt, right, down the line. If you know you're hypertensive, you can take steps before you get to these points. Because if you don't know that you're hypertensive and you're not treating it, you can have the following things happen. You can have damage to your blood vessels, leading to like arteriosclerosis or atherosclerosis. You can have vascular damage in the organs, including in the blood vessels in your brain, which can lead to something like a stroke. You can have blood vessel damage in your kidneys, which can lead your kidneys to fail. You can have basically an overgrowth of muscle in the heart, so abnormal hypertrophy. This is basically the ventricles are overloaded to eject blood. This can cause problems with like arrhythmias. It can cause cardiac arrest, which means your heart stops, and other forms of heart disease. So by the time, again, that you don't know that you're hypertensive unless you've either had your blood pressure checked or you've let it go for so long that these are things that are happening. So you wouldn't know until you have a stroke. You wouldn't know until your kidneys fail. You wouldn't know until you have a heart attack or whatever, right? You wouldn't know those things, right, until the catastrophe hits. You wouldn't realize you had hypertension until catastrophe. So this is, again, one of the reasons why we check blood pressure religiously. Now, the good thing is there are treatments. There are lots of treatments for hypertension. Sometimes, again, depending on the type, if you have another condition that leads to an increase in blood pressure, then we can treat that condition and hopefully the blood pressure resolves along with it. But generally speaking, there's a handful of things we can do. The big one that you noticed over and over and over again was lifestyle modification. And that means maintaining a healthy weight, exercising, and then paying attention to like your diet, so limiting salt intake, limiting drinking, and then also other things like limiting smoking, right? All of these things, if you have a high salt diet, if you drink a lot of alcohol, if you smoke, if you are carrying excess weight, if you're sedentary, all of those things can contribute to hypertension. We can give potassium supplements, right? Because remember, potassium is going to have a negative impact on things like blood pressure and whatnot. So potassium can help. Diuretics, basically to decrease blood volume. So thiazide is a good example of that. Direct vasodilators, so like minoxidil, sodium, and whatnot. Those things can just cause vasodilation, which will decrease blood pressure. Beta blockers, they'll decrease cardiac rate. ACE inhibitors, ACE, right, angiotensinogen, converting enzyme, that's what ACE stands for, is angiotensin converting enzyme. So ACE inhibitors will block angiotensin 2 from being produced. We know angiotensin will increase blood pressure, so if we block angiotensin, we will decrease blood pressure. And then angiotensin 2 receptor blockers, which are similar-ish, however, we're just blocking the response. We're blocking the receptors that would respond to angiotensin. Moving on to preeclampsia, this is something that happens during pregnancy. This is relatively common, or more, we'll say relatively common. Usually we're looking at later parts of the pregnancy, so week 20 and beyond. This is where someone who does not have hypertension normally suddenly does have hypertension, and we see that damage to the organs, so damage to the kidneys, damage to the liver. We see that, this person could have a stroke or seizure. So this is something that definitely needs to be cared for, right? This is something that needs to be dealt with in a medical setting. It's probably related to the fact that the placenta is having some sort of dysfunction. And we see that preeclampsia risk increases as a patient's body mass increases as well, like their BMI goes up. So as a person with obesity would be at a higher risk of developing preeclampsia during pregnancy than someone who is not. We may see thrombocytopenia and proteinuria, protein in the urine, and decreased thrombocytes, so decreased like clotting factors and whatnot. So decreased platelets, which means, decreased ability to clot. Proteinuria, because we're losing proteins in the urine, we're also losing proteins in the blood, and so we're going to lose our ability to pull fluids from tissues back into the bloodstream. So things like edema, swelling in the hands and feet, swelling in the legs can occur with preeclampsia. Another one is congestive heart failure. This is basically the heart losing its efficiency as a pump. So the heart is not pumping correctly, or it's not filling correctly. There's a lot of things that can lead to congestive heart failure. So congestive heart failure is more of like an end result rather than like an individual disease. So things like coronary artery disease, hypertension, damage to the heart muscle, aortic valve stenosis, electrolyte imbalances, a lot of things can lead to congestive heart failure. When someone has congestive heart failure, they're going to experience shortness of breath, they're going to be tired, they're going to have edema, their heart rate is going to be increased to try to compensate for the ineffective nature of the heart as a pump. Things that can help with this is a lower sodium diet, limiting fluid intake, prescription medications, and then getting a pacemaker put in. Now, something else that can happen is shock. Shock is basically the blood flow is no longer adequate because to match the oxygen uses of the tissue. So the tissues are using more oxygen than the blood flow can bring. A lot of times this means blood pressure is so low that we just cannot properly get blood to flow to organs properly. And this means that organs, they are oxygen starved, right? There no ATP production because there's no oxygen, or very low ATP production because of no oxygen. And this leads to organ damage. Shock can lead to death because that blood pressure is so low, the organs are literally starving for oxygen. And if the organs are starving for oxygen for too long, then those tissues will die. There are the symptoms that we experience are due to that inadequate blood flow. And we have some changes where we're basically trying to compensate. We're trying to bring blood pressure back up. We're trying to compensate for that loss of blood pressure. There's a couple things that can lead to shock. Hypervolemic. This is because we have a large scale like blood loss or fluid loss, so like a traumatic injury, which will lead to a decrease in blood pressure because the volume is just not there anymore. Cardiogenic. This is heart failure, because the heart muscle is just not able to pump properly, which means we cannot adequately push blood out, right? The heart's just not pumping well, like it's just not pumping like with any strength. Vascular, this is like where we have that vasodilation. So like if someone has that allergic reaction and they go into anaphylaxis, right? Vascular would be that type of shock in that case, or septic shock, like when we have an infection in like the bloodstream. And then obstructive, this is because we have clots that are obstructing flow, and so blood pressure down the line would drop. What are some signs and symptoms of shock? This person's skin would be clammy and cool and pale. Their heart rate would be much higher, but their pulse, because the heart rate's higher, their pulse will be rapid, but it's not going to be very strong. It's going to be very weak. So you could feel it often, but you can't feel it very strongly. Sweating, right, which kind of contributes to that clamminess. Hypotension, so their blood pressure will be low, right? Their mental status will be altered, so they may not be able to respond very well to you. They may have confusion, right? They may not be able to answer questions, right? Or if they answer your questions, let's say you ask them their name and they can't remember their name, or you ask them what day it is and they tell you it's, oh, it's lemon, right? And you're like, what? So absolute confusion, lethargy. They may be very anxious, right? They may have this feeling of of anxiety or restlessness, decreased urinary output. They'll be really, really thirsty, and in their blood they may have acidosis. So they will have a higher, or I should say a lower pH, right, overall. and their body temperature will drop too. So a lot of different signs and symptoms of this. If you're seeing these together, then that means that it's this is an absolute like emergency. This person needs to see the emergency room like now. So what are the cardiovascular reflexes that kick in when we experience shock? Namely, the sympathetic nervous system kicks in. So we're going to release adrenaline, so epinephrine, norepinephrine. This is going to increase the cardiac rate, which is going to increase stroke volume to try to compensate for the low blood pressure, right? Because if we increase the cardiac rate, we can kind of keep the blood pressure up. We're going to decrease blood flow to the digestive tract and the skin, which leads to that coolness and that clamminess, right? And the decrease in the urine output because, again, we're constricting those arterioles and whatnot. So we're really kind of just, our focus is to pump blood to get that blood pressure up, and that means shunting it away from things that we don't need to spend it on right now. RAS activation, again, that's the renin, angiotensin, aldosterone system. We're going to have angiotensin and aldosterone released so that we can retain things like sodium, which will then pull water in so that we can decrease urine output but also increase blood volume. And if we increase blood volume, we increase blood pressure. So we have these reflexes that kick in this emergency situation to try to basically increase the blood pressure by increasing the heart rate, increasing how much blood we eject with each heartbeat, and then increasing the blood volume, right? We have several things that are involved in trying to retain as much blood volume as possible.